Good evening, Mr. Alan Bernard. My name is Ida, and I'm a nurse practitioner student at United States University based in San Diego, California. Today, I am assigned to do your HEENT examination. It means examination of the head, the eyes, the ears, the nose, and the throat. Before we start, I would like to ask your permission if it's okay that we can videotape and I could transfer it to YouTube so my instructor could review the examination process.
Yes, you can.
Okay, I'm going to ask you to state your full name and date of birth.
I'm Alan Bernard. I was born March 26, 1965.
And also, if during the examination process, if you have any questions or you feel uncomfortable or any discomfort, just let me know.
Okay.
So we will start with the head examination. So first, I'm going to inspect your head for the hair distribution. I would also inspect for the shape of the head, if there's any trauma, any lesions, or any rashes. And so far, there's none. And the next thing is I'm going to palpate your head. I'm going to check for your hair texture, going to check for any deformities, any depression in your skull, any lesions as well, and hematoma. So far, it's normal and healthy. The next thing we are going to do is we are moving to your eyes, and I see that you are wearing corrective lenses.
Yeah.
Okay, so I'm going to give you specific instructions. Just listen to it because there are examinations that I have to ask you to remove your eyeglasses. So the first one that we're gonna do is what we call the Snellen's test. This is a test where we are going to check for your visual acuity. I will be 6 feet away from you using this card. What you're gonna do is you will cover your, you're gonna read this with one eye cover, and then we'll do from right and we'll do left, and then we will let you read the Snellen's card with your both eyes uncovered. So you will read the smallest letters that you can. So we will start with, okay, you covered your right eye, so we will start with your left eye. Can you read the smallest letter, please?
LTFFH.
Okay, can you uncover your right and cover your left eye?
LTFFH.
Okay, uncover both eyes and read the smallest letters.
LTFFH.
Okay, so that's a vision of 20/20 with your eyeglasses on. The next thing that we're gonna test is I'm going to inspect your eyes. If you can take your eyeglasses off, I'm going to check for symmetry, your eyebrows, and then movement of your eyelids to make sure that they are moving symmetrically. Also, I'm gonna check for exophthalmos if there's ptosis, or and check for your eyelids. So I'm going to move your eyes here. Okay, have you look down? All right, so I can see your conjunctiva and I could see your sclera. Okay, let me check the bottom here. Okay, I could see also your conjunctiva again and your sclera. I could see also your pupils and your iris. So the conjunctiva is pinkish, it should not be yellowish, and then your sclera is whitish, white in color. And then I'm going to check your lacrimal duct here. Want to make sure that there's no extra tearing and also presence of exudates. So with the use of my pen light, I'm going to check your pupillary reaction, which is the direct reaction to light, and also the consensual reaction to light. So this is actually part of testing the cranial nerve number 3, which is the oculomotor. So I will do your right eye first. Okay. So I could see your eyes, your pupils constricting. Let me do another one and see. Okay, I could see that your left eye is constricting as well. So that's the direct and the consensual testing of your pupillary reaction. Okay, let me check your left. All right, and then, okay, I could see your right also constricting the same way and in the same size from 2 to 4 millimeter, the same as your left eye. So that is for pupillary reaction. The next thing that I'm going to check is your oculomotor or cranial nerve number 3, cranial nerve number 4, which is the trochlear, and cranial nerve number 6, the abducens. These are your extraocular motions or extraocular movement. So the abducens or cranial nerve number 6 is responsible for the lateral movement of the eye. The trochlear, which is the cranial nerve number 4, is responsible for the downward and the medial movement of the eye. So I would like to ask you to just steady your head while I'm doing some signals using my fingers. If you could just move your eyes towards that direction. Okay, let's start it. Can you see?
Yes.
Okay.
Yes. Yeah.
All right.
Yes.
Just follow with the movement of your eyes.
Yes.
Okay, so with this one, I'm also checking for presence of nystagmus, which is the abnormal or involuntary movement of your eyes, and there's none right now. And the next one that I'm going to check is I'm going to check for the visual fields by confrontation. So what I need you to do is, if you can cover your right eye for me, and then tell me when you can see my fingers.
Yeah. Yeah.
Okay, cover the other eye.
Yes. Yes.
Okay, so with both eyes uncovered, tell me when you can see my fingers.
Yes. Yes.
All right, so that would be for visual fields. And then next one is using my pen light here. I need you to look at the tip of the pen light, and I'm going to move this closer to you so I can see how your eye movement is. This is checking for convergence and accommodation. So if you can, all right, okay. So your pupils constrict when it becomes closer to you. So this is for, as I've said, checking for convergence and accommodation. So the next testing is I'm going to check the internal structure of your eyes, and I'm going to use the ophthalmoscope. So normally when checking for, when doing the fundoscopic exam, it should be on a dim light. So with my right hand, I will use my right hand to test the right eye with a dim light. It's a little dim, so okay. All right. I could see the red reflex. All right. And I could see the blood vessels. I'm going to go towards that and check for the optic disc. Okay. All right. And I will do the same way on the other side. So I will use my left hand to check on your left eye. Okay. Okay. I could see the red reflex. Okay, and I could see the blood vessels and the optic disc. All right. Okay. And the next one is I am going to check for your nose. So the first thing I have to do is inspect again. I'm going to inspect your nose for symmetry and making sure that your nostrils are of the same size. Then I have to palpate your nose, okay, making sure there's no masses, okay, and then I have to palpate for your frontal and maxillary sinuses. So I'm gonna palpate and then your maxillary sinuses. The next thing is I'm going to inspect with the light. I could use my pen light here. I'm going to inspect your nose and check on your membrane and your turbinates. Okay. My gloves is sticking. So anyway, so with my left thumb or one of my fingers, I'm going to visualize or inspect your nasal passages. Okay, so I'm gonna use this. All right, so let me check. Okay, I could see your nasal membrane. It's moist, it's pink, there's no nasal discharges, and there's some hairs. Okay, let me see your right. The same thing. Okay, it's moist, it's pinkish, there's no nasal discharges, and then there's hairs. The next thing we're gonna do is I'm going to ask you to like cover one of your nostrils, and then you can actually breathe so I could feel the airflow. Okay, let's do the other one. All right, so there's no obstruction on your nostrils. The next one is we are going to test your smell with your eyes closed. Try to cover one of your nose. Can you tell me what's the smell?
So.
Okay, let's do the other one. You cover your eyes and then we'll test the other.
So.
Okay, so that would be for your nose. The next thing is we are going to check your ears. So this time I'm gonna start with inspection. So I'm going to check your anatomical position of your ears to make sure that they are symmetrical. I'm going to check the external canal for any drainage and if there's any cerumen. The same thing on the other side. There's no drainage, there's no cerumen that I could visualize. And also I'm going to test your gross hearing. It could be done by a watch tick, or it could be by the whisper test. So I will be situating myself at your back. I am going to ask you to cover one of your ear, and then I will whisper a phrase, a word, or a number, and you let me know if you hear it. Okay? All right. How are you?
Yeah, I hear you.
What did I say?
How are you?
All right, let's cover the other ear. 1, 2, 3, 4.
Yes, I hear you.
What did I say?
1, 2, 3, 4.
Okay, so that is correct. Hearing is good through the whispers test. The next test I'm going to do is the Weber's test. With the Weber's test, I'm going to ask you to tell me if you can feel or the vibration on both of your ears. I'm going to put the tuning fork on your forehead.
Yeah, I hear it. Both.
Okay, thank you. The next test that we are going to do is called the Rhinus test. With this test, I'm going to test both of your ears. I'm going to initiate vibration of the tuning fork, then I'll put it behind your ear. You tell me when you don't hear it anymore, and then I'll put it directly beside your ear.
No more. Yes.
Okay,
No more.
so let's test the other one. The same thing. You tell me when it stops.
Stop. Stop.
Okay, so that is testing the air conduction and the bone conduction of your ears, and both is equal. I mean, you can hear bilaterally with the air conduction, more sensitive than the bone conduction. The next testing that we are going to do is I'm going to use the otoscope, and I'm going to check your external canal, your tympanic membrane, and the cone of light. So okay, but before performing that, I would like to palpate first your ears, check your pinna, palpating it, and then your tragus. Can you feel any pain or tenderness when I do that?
No.
Okay, how about here?
No pain.
Okay, if there is some tenderness and pain, it calls for further examination. Sometimes it could be an indication that there's an infection. So the next thing we're gonna do is, as I've said, I'll check using an otoscope. I'm going to check your external canal, your tympanic membrane, and the cone of light. So with okay, all right, I could see your tympanic membrane. Your ear is dry, and there's no cerumen, there's no fluids. All right, let me just check for the cone of light. All right, and the cone of light is at 5 o'clock. Next one is I'm going to check your right ear. So it's the same thing. Okay, I'm checking the tympanic membrane. It's your external canal is dry, there's no drainage again, and the cone of light is at 7 o'clock. All right, and that is with the use of an otoscope. The next thing we're going to do is we are going to check your mouth, your throat, your neck, and your face. So I'm going to put my gloves so we could inspect your mouth. So the first thing I'm going to check is your lips. So the lips should be checked for dryness, and if there's any cracks or any lesions on it. Then I'm going to check your vocal mucosa, your gums, your gingiva. I'm gonna use the light here, and then I'm going to check your teeth for any abscess, any dental caries, or any dentures. When I check your gums, I'm going to check for pigmentation, for any hypertrophy, or any signs of infection. I'm going to check your tongue. So if you can open your mouth. All right. Let me see. Okay. So your big mouth, please. Okay. So I'm checking your soft palate, your gums. It's pinkish. Your teeth, there's no dental caries, there's no abscess. Okay. And then I'm checking your tongue. The anterior aspect of your tongue is smoother. It's pinkish. Can you lift your tongue, please? Okay, the posterior is coarser. And then the next thing I need you to do for me is we are going to test the cranial nerve number 9 and number 10. And that's the glossopharyngeal and the vagus nerve. So I need you to say for me. And I will check for, okay. All right, I could see your uvula there. It is in the midline. It's moving upwards when you say and I could see your tonsils. It's actually pinkish. There's no swelling. There's no, white patches on your tonsils. And also, can you please move your tongue out? I'm going to check for the strength of the tongue. Move side to side, making sure that there's no deviation. And also, I'm going to palpate inside just to make sure that the gums and your palate, okay, there's nothing. All right. And that is examination of the mouth. The next one is we are going to do your neck. We're going to test for a range of motion. So I want to ask you if you could flex your neck and then extend it. Okay, turn side to side, and then do your rotation of your neck. Next one is I'm going to put okay, you can stop now. I'm going to test the spinal accessory muscle, which is I'm going to put pressure on your shoulder, which is your trapezius muscles, and then you put a resistance on it. Okay, the next thing is I'm going to ask you to turn your head, and I'm going to hold it, and you continue to put resistance. And this is the part of the cranial number 11, which is the spinal accessory, and that is testing with your sternocleidomastoid muscles. Next one is we are going to test for the lymph nodes. So I'm going to start with the periauricular. So I'm using the pads of my fingers. It could be 2 or 3 fingers in a circular motion, feeling for any mass. Okay, and then we have the posterior auricular. All right, and then we have the submandibular, and then press on the or palpate on the submental. Next one is we have the subclavicular, which is top of your collarbone or your clavicle. And then the next testing we're gonna do is the anterior cervical. So I'm going to palpate for your anterior cervical lymph nodes. Okay, and then I'm going to do the posterior cervical lymph nodes. Okay, I'm going to test for your occipital lymph nodes, which is just behind your neck. And then I'm going to palpate your trachea, which is in the midline. Okay, there we go. All right, the last thing that we are going to check is the thyroid. I'm going to ask you to swallow while I'm trying to visualize or inspect the thyroid gland. And then I'm going to palpate it. And then if you can swallow again. And I'm trying to palpate it. I'm going to find it by going through the midline. And then I could feel your cricoid cartilage here, and then 2 rings below that would be the best site to palpate your thyroid gland. So I will be in your back, and I'm going to find my midline there, and then I'm going to find your thyroid here. So I'm pushing it and I'm trying to palpate your thyroid this side, and then I could feel it on the other side. Okay, so that is with the thyroid gland, and we are done with our HEENT examination. Thank you.